You know that feeling, right? When you, or maybe someone you care about, is stuck on a healthcare waiting list.
Oh, yeah. It just seems endless sometimes, that feeling of just waiting.
Exactly, that frustration, the uncertainty. It's tough, and it's something a lot of people, well, can relate to.
Definitely.
So today, we're doing a deep dive specifically into that. Right here in Aruba, we're looking at how the Instituto Medico San Nicolas IMSAN, everyone calls it IMSAN, how it could be, well, strategically used
to really make a dent in those frustrating wait times.
That's the focus. We're working from a strategic briefing we've looked at, which basically lays out some ideas.
Right, it's like a blueprint almost. Our mission here is really just to pull out the key stuff for you.
Yeah, distill it down so you can quickly grasp the situation and maybe more importantly, the potential solutions being discussed.
Exactly. Get a clear picture fast.
Okay, let's get into it then. IMSAN, it's known for its work on chronic diseases, right?
That's correct. Chronic non-communicable diseases are a primary focus. But what this briefing highlights is the infrastructure they have.
Infrastructure that could be maybe leveraged more broadly.
Precisely, for wider healthcare access. And their capabilities are quite striking when you list them out.
Like what? What really stands out?
Well, for starters, they run a 21-bed medical surgical unit. It operates 24/7.
24/7 for medical patients and post-surgery care.
Yep. That's a pretty significant resource already available.
Okay. 21 beds, 24/7. And it's not just beds, right? They do surgery there too.
They do. They have a whole surgery complex. They handle things like ENT, general surgery, jaw surgery, eye surgery.
Eye surgery. I think I saw a number on that. Cataracts?
Yeah, that really jumps out. They did 1,200 cataract surgeries in 2023.
1,200. Wow. So, I mean, couldn't shifting more of that kind of thing, those routine eye surgeries, couldn't that help the list at HOH?
That's exactly the kind of strategic thinking the briefing is pushing for. Use IMSAN's proven capacity.
In areas like cataracts.
And you could directly shorten those specific waiting lists. But it's not just eyes. They also do orthopedics, pain management, plastic surgery.
Okay, quite a range. And they have specialized centers too.
An eye center, which apparently got recent AZV funding for better diagnostics.
Oh, interesting.
A radio-oncology department treated about 250 patients last year. And a 247 emergency department.
Wait, 247 ED? How busy is that?
Well, the briefing says they saw 16,000 patients in 2023.
16,000. Okay, so they're definitely a player in urgent care already. Does that take away from their ability to do more planned stuff?
That's a fair question. It definitely needs coordination.
Yeah.
But, having that functioning ED alongside surgical suites and inpatient beds, it actually speaks to their overall capability.
Right. It shows a certain level of operational capacity.
Exactly. And there's more dialysis, a diabetes center. Their lab, med lab, is internationally accredited.
Okay.
And they run the island-wide ambulance service. 10 ambulances. It's pretty comprehensive.
It really sounds like it. And then there's this accreditation thing. The briefing mentions a JCI Gold Seal in 2023.
Yes, the Joint Commission International Gold Seal of Approval.
What does that actually mean for listeners who aren't familiar? Like, why is that important?
It's a really big deal. It means IMSAN meets tough international standards for quality and patient safety. It's a major validation. Puts them on par with top institutions globally, basically.
Okay, so quality-checked international standards. Now, here's something that seemed, well, a bit confusing. The briefing mentions an HOH statement from back in 2021. It suggested IMSAN was kind of limited. Low-complexity patients couldn't do 2047 care.
Right, I saw that reference.
But that sounds totally different from the 2047 surgical unit and the JCI Gold Seal you just described. What's going on there?
Yeah, that contrast is, it's a key point. The older perception versus the current documented reality.
So the reality seems to be this capable, accredited facility.
The evidence, like the 247 unit and the JCI seal, strongly suggests their capabilities have, let's say, evolved or maybe weren't fully recognized before. Bridging that perception gap is going to be critical.
Okay. So if IMSAN does have this potential, this maybe underused potential, how do we actually start using it better? The briefing talks about collaborations, right? Especially with HOH.
Yes. Synergy between IMSAN and HOH is central. One area they flag is joint medication management.
Medication management. Okay, maybe not the flashiest topic, but the briefing says it could have a real impact. How?
Well, think about it. Right now, it seems there isn't one single formalized system across both places. Okay? So imagine a patient seeing doctors at both HOH and IMSAN different prescriptions maybe. Without a shared system, the risk of errors like drug interactions goes up.
Ah, I see. So a unified system could catch those potential conflicts.
Exactly. It could automatically flag problems, boosting patient safety. Plus, you could get efficiencies, maybe shared purchasing, better use of pharmacists.
Pharmacists.
Maybe IMSAN pharmacists could even remotely help with medication reviews for HOH patients, for example. Lots of possibilities.
That makes a lot of sense. Safety, efficiency. But getting two different organizations' systems to talk to each other, that sounds complicated.
Oh, it absolutely requires effort. IT interoperability is key, making sure their computer systems can share that medication info seamlessly, like getting different software to speak the same language.
Right. And protocols, training.
Definitely.
Yeah.
Standardized procedures, training for everyone involved. But the payoff, safer care, better outcomes, efficient resources, aligns perfectly with those JCI standards we talked about.
Okay. What's the next collaboration area? Specialist deployment.
Yes. Optimizing how specialists are used across the island. The briefing notes that 7 specialists were already working at IMSAN back in 2022.
So there's already some sharing happening.
Exactly. The opportunity is to formalize that and, importantly, expand it, especially for specialties with those long HOH waiting lists.
Like which ones?
Ophthalmology is a big one, obviously, given the cataract example. But also orthopedics, ENT, pain management, general surgery, areas where IMSAN already has some surgical facilities.
So a patient waiting ages for, say, an orthopedic consult at HOH might get seen sooner at IMSAN, maybe even by the same doctor.
That's the idea. Have specialists split time, hold clinics at both sites, whatever works best to tackle those backlogs.
Makes sense conceptually. What are the hurdles, though, making that actually work smoothly?
Well, you need clear financial agreements. That's crucial. Between the institutions, with the specialists themselves.
Okay. Money sorted. What else?
Scheduling. It would need to be really tight coordination to make sure time isn't wasted, patients flow smoothly.
And information. Records.
Absolutely critical. Seamless access to electronic health records at both places. And you also have to manage the human side, maybe some staff resistance to new ways of working. Clear communication is key.
So patients feel like it's one system, even if they go to different buildings?
That's the goal. Thinking of specialist care as one Aruba health resource, really?
Okay, let's shift to the physical side again. Those 21 medical surgical beds at IMSAN, operating 204/7, how can they be used better?
This is where we can really challenge that older idea about IMSAN's limits. These beds are a key asset.
So, how? What kind of patients?
Several groups. First, elective surgeries, the ones that are low to moderate complexity.
Linking back to those surgical capabilities like the cataracts.
Exactly. If IMSAN can handle more of those planned, less complex cases, it frees up HOH's operating rooms and beds. For the really acute or complex stuff, it's about matching the patient to the right level of resource.
Okay, offloading some planned surgeries. What else?
Second, think about post-acute or step-down care.
Step down?
Yeah, patients who are past the critical phase at HOH, maybe after major surgery or illness. They're stable, but still need nursing care, rehab, medication monitoring.
But maybe not the super high-intensity resources of an acute HOH bed.
Precisely. Transferring them to an IMSAN bed for that recovery phase gets them the care they need, but frees up that vital HOH bed much faster.
Okay, that makes sense for flow. Any other uses?
The briefing suggests maybe some outpatient diagnostic procedures too, especially with that enhanced eye center they have.
So a more efficient way to stream patients based on their actual needs. But back to that 2021 statement again, the low complexity thing. How do we make sure using these beds more broadly is actually safe and appropriate?
That's absolutely paramount. The key is clear, agreed upon rules.
Rules for who goes where?
Exactly. Patient selection criteria. Care pathways. Developed together by the clinical teams from both IMSAN and HOH.
So everyone's on the same page about which patients are suitable for IMSAN.
Right. And remember the JCI accreditation, it's independent proof of their quality and safety standards. Plus, the fact they are doing high-volume cataract surgery successfully shows capability in at least one specific area.
Got it. Clear criteria, collaboration, and leveraging that JCI standard. Now, the briefing also talks a lot about people, human capital, and IMSAN's Education Center seems pretty central to this.
It really does. That center, being AHA accredited, it's positioned as a potential hub for ongoing training, continuous professional development, or CPD.
For staff from both IMSAN and HOH.
That's the idea. Standardized certifications, specialized skills, sharing best practices, lifting the level of care across the whole system.
And it's not just about, ticking boxes for qualifications, is it? I saw mention of cross-training, flow concepts.
Exactly. Cross-training builds flexibility. Staff who can step in and help in different areas when needed. That makes the whole workforce more adaptable.
And flow concepts, what does that mean in practice?
Think about streamlining the patient's journey, making sure they get the right care in the right place at the right time, without hitting unnecessary delays or bottlenecks. There are established methods for this, like from the Institute for Healthcare Improvement, that joint training could help implement.
Making the whole system work smoother for the patient. The briefing also mentioned patient education, especially for chronic diseases.
Yes, and IMSAN seems well placed for that, given their diabetes center and chronic disease focus.
How does educating patients help with waiting lists, though?
Well, if patients are empowered to manage their own chronic conditions, better diabetes, heart disease, whatever it is.
They might have fewer flare-ups, fewer emergencies.
Exactly. Fewer acute episodes needing urgent specialist care or hospital stays. It reduces demand on those specialist services in the long run.
Proactive management reducing downstream pressure.
Right. And they could use e-health, digital tools to reach more people. Joint training on how to educate patients effectively would also ensure consistency.
Okay, that makes sense. But even with great facilities and training, you still need the actual people. Recruitment, retention, those are big challenges everywhere. HOH flagged it too.
They are huge challenges.
Yeah.
The briefing suggests tackling this requires a coordinated national effort.
Not just IMSAN or HOH acting alone.
No. Things like national recruitment campaigns promoting Aruba's whole healthcare sector, building talent pipelines with schools, modernizing HR practices to be more attractive, creating clear career paths so people want to stay and grow here.
And IMSAN's Education Center, how does it fit into solving the personnel problem specifically?
It can deliver targeted training, upskilling existing staff for these new collaborative models, maybe telehealth, or better discharge planning to free up beds faster.
Discharge planning, right, getting patients home or to the next step smoothly.
Exactly. And mentorship programs to support new hires. The key, again, is coordination. Avoid IMSAN and HOH competing for the same nurses or technicians. That doesn't help anyone.
And maybe if the workload is better distributed, using IMSAN's capacity, that helps keep staff from burning out.
That's a really important point. Better workload balance is crucial for retention, happier staff, better care.
Okay, this has been really comprehensive. We've covered IMSAN's potential, collaborations, infrastructure, people. The briefing also had recommendations for the Ministry of Health, right, as the sort of overseer.
Yes, the ministry's role is seen as critical and enabler, really.
What kind of actions should they be taking, according to the briefing?
Facilitating the dialogue, for one. Helping IMSAN and HOH hammer out formal agreements.
Getting them talking, officially.
Right. Maybe setting up a national waiting list reduction task force to keep things moving, providing the policy support regulations for specialist sharing, joint medication systems, using those IMSAN beds.
So, clearing the bureaucratic hurdles.
Pretty much. And strategic investment, of course.
Where should the money go?
Into these collaborative projects, into boosting IMSAN's Education Center capacity, championing that national HR strategy we talked about.
Okay. What else for the ministry?
Promoting data sharing securely, of course, so decisions are based on real information. And maybe a public awareness campaign.
Why public awareness?
So the community understands why these changes are happening, what the benefits are, and supports the shift towards a more integrated system.
It really sounds like it needs strong leadership, doesn't it? And a real shift in mindset towards collaboration.
Absolutely. It's less about individual institutions and more about the whole system working together. The briefing suggests maybe starting small, a phased approach.
Like focusing on one area first.
Yeah, pick something high impact but feasible, like really ramping up ophthalmology at IMSAN first. Build some success, show it works.
And keep checking the data. Adapting.
Constantly. Monitor, measure, adjust. It has to be data-driven.
Okay. So, if we boil it all down, the key takeaway seems to be that IMSAN is this significant resource.
A potentially underappreciated one.
That could be a major partner in cutting down those healthcare waiting lists in Aruba.
That's the core message. But unlocking that potential, it needs that shift. Collaboration, shared responsibility, viewing IMSAN and HOH resources as sort of one combined asset for Aruba.
And it's not just about shorter waits, is it? It's bigger than that.
It really is. It's about building a healthcare system that's more resilient, more integrated, where the different parts support each other. Better standards, better equity for everyone.
Which leads us to maybe a final thought for you, the listener.
Yeah, thinking beyond just this Aruba example. Where else in our healthcare systems, or maybe even in completely different fields you know about?
Are there resources, assets, maybe people or infrastructure that seem kind of overlooked, underutilized?
Could unlocking those be a key to improving things?
Yeah.
Access, outcomes, efficiency. Maybe thinking about the whole system, not just the individual pieces.
Could spark some new ideas for tackling the big challenges we face. Something to mull over.